Hello and welcome to Africa Today. I am Esther Mokwariola. Every 60 minutes in Africa comes with a strong possibility that health concerns like malaria and maternal mortality could make the next news bulletin, ensuring that a host of silent killers remain relatively unnoticed. Among these passive pandemics, tobacco is responsible for at least 5 million deaths every year, according to the Tobacco Atlas, with nearly 80% occurring in developing countries. Well, Africa's bright future looks covered in smoke, as an estimated 77 million people currently put their health at risk with the use of tobacco-related products. And so we ask, what are your thoughts on tobacco control, restriction and legislation in Africa? You can join the conversation and share your thoughts with us on Twitter at TVC Connect. Here is a report to launch the program, and Africa Today will be right back. Welcome on board.
Issa has been smoking for more than 20 years. He says he understands that the habit is bad for his health, but he just can't help himself.
I don't pass 20 years where I smoke. I don't try make a labor the cigar. I know when they can die. So the people who tell me say they hot where they inside, they chop something where they inside.
Godwin, on the other hand, says he was forced to quit smoking a few months ago when his health was threatened.
As an addict smoker, at first it was not easy to stop, but I have no option than to stop because it's beginning to affect my lungs. It's beginning to affect my health. I can no longer breathe well and some things like that.
This consultant respiratory physician says tobacco contains a lot of harmful chemicals that eventually lead to disease and disability.
What people take in tobacco, what they're after is the nicotine. However, the nicotine comes with other chemicals. Like in tobacco, you have more than 4,000 chemicals in tobacco. Out of these, 250 have been found to be harmful, and some of them are carcinogenic.
The pulmonologist also says second-hand exposure is just as bad for the innocent bystander.
When people smoke and they exhale the cigarette smoke, the components they exhale into the environment contain some of these harmful compounds we have talked about, and when other people inhale them, they can also suffer some of these side effects. You found women who had lung cancer, and when you ask them, did you ever smoke cigarette? They'll say no. But when you probe further, they'll tell you that their husband was a chronic smoker.
Tobacco use has continued to be a major public health issue across the world. In 2014, Lagos State signed the anti-smoking bill into law to prohibit smoking in public places, but people still smoke openly. It's hoped that such law will be replicated at the federal level so that Nigeria can fully join the rest of the world to discourage tobacco consumption.
Welcome back. Latest data from the World Health Organization shows that out of 27 countries where smoking rates have increased over the past 15 years, 17 are in Africa. Although a high percentage of smokers are adults, adolescents are said to be catching up and even surpassing the previous generations on the continent. Joining me on Africa Today to discuss this in the studio, I have Akimbode Olufemi, an environmental rights activist. Thanks a lot for being a part of the program.
Thanks to be here.
And on Skype, I have Eno Isong, Associate Director, International Communications at Campaign for Tobacco-Free Kids, Washington, USA. Thanks a lot for being a part of the program, madam.
Thanks for having me.
And also on phone is Leon Sesu, Communications Manager, African Tobacco Control Alliance, Togo. Thanks a lot as well for being a part of the program.
Thank you. Thank you.
Right, let's start with you, Bode. Why is the tobacco industry, let me start like that. Why is it targeting Africa?
Well, I think Africa is being seen now as the last frontier for the tobacco industry. Why? Because, smoking rates used to be very high in the West, and they realized the health impacts of smoking. And then governments around the world in those countries started taking legislations, policies to ensure that, smoking rates, begin to come down. In Asia, it has also been very high, and the countries are also doing some measures. You have some of the most progressive laws now coming out from some of those continents. Africa has very weak laws. People do have, very limited knowledge about the harms that smoking causes. We do have governance issues in terms of our democracies and capacity to enforce the law. So those companies now realize that, look, the market seems to be shrinking in Europe, are beginning to shift to our continents where there are, weaker laws and impressionable, population that will easily replace those either people that are dying or they're actually dropping the sticks in some parts of the world. So Africa becomes a major target, and we have, even within Africa, countries with population like Nigeria, South Africa, Senegal, that they also believe have some level of disposable income, and those income they think should go to smoking and to the smoke.
All right, let me quickly bring in Eno, who joins me now from the Washington, D.C. Eno, recent research showed that there are more children smokers than adult smokers. What are your concerns about this?
I'm very happy that you've asked that question. It's not by happenstance that we have a lot of children smoking. The tobacco companies see the young people as their replacement smokers. As Bade had said, people who have been smoking for years kind of either die or sometimes they even stop smoking. And the tobacco companies have realized that they need to keep on replacing the smokers who have, grown out of that cohort. And so they deliberately target children, especially, to make sure that they are able to get them while they're young and keep them for the next 25 years. Research has actually shown that the tobacco companies have done their research. They found out how to build their marketing strategies, and they're deliberately going after children as young as 6 years old to make sure that they entice them, to make sure that they hook them, and to make sure that they hold on to them till eternity, So you see them marketing their products to children near elementary schools. I know that a lot of us just walk by elementary schools and see vendors selling cigarettes, and I don't know whether it's ever occurred to anyone, why are you selling cigarettes in front of an elementary school? It is a strategy that the tobacco companies have put up, and they're pouring money into it to make sure that they target young kids and they get them hooked on their products.
All right, let me quickly get in Sesu on his thoughts on this. Sesu, what is the prevalence rate of smoking among children in Togo, and why does the marketing of tobacco products to these vulnerable groups seem so profitable, not minded the inherent health dangers?
Yeah, as today, the smoking rate here is getting high because of the promotion around the schools. And the rate of smoking in the country is about 10%, but this is still from the data that is being collected from the country level, showing that this rate will be increasing in the next years. So we need to do something because this rate is going to be high in the next years.
All right, let me quickly get Eno's view on this matter. Eno, you mentioned earlier that 6-year-olds are involved in tobacco smoking, but I'm quite, this is quite disturbing, such a news to hear. But how factual is that?
I do want to say that it's disturbing that our young kids, as young as 5-6 years old, are being targeted with tobacco products. I know that all of us as growing up, kind of, it gave you an image like you were the rebel. And these are things that the tobacco companies keep on putting towards young people to get them addicted to smoking. They realize that teenagers who are usually rebelling against parents or against authorities, they realize that young people really are not mature enough to make informed decisions. They realize that young people sometimes have disposable income, go ahead and buy things that are really cheap. And so they use those platforms to target young people as young as 5 years old. And believe me, when you start smoking so young, by the time you're 18, 19, there's a huge chance that you're already addicted to the product.
All right,
so the whole idea is to make sure that we're able to build understanding of the community that distinction.
All right, let me hold your thoughts there, Enoh. We have to go on this quick break. You're watching Africa Today, and we've been looking at tobacco control, restriction, and legislation in Africa. Stay with us here for more. Welcome back. While tobacco consumption globally is decreasing, the number of smokers in Africa is anticipated to rise by nearly 40% in 2030, with tobacco companies exploring the market and taking advantage of a youthful population of prospective lifelong smokers. Well, Bode, just before we went on break, we heard Madam Enoh giving her own perspective on why young children are the targets of tobacco companies in Africa, probably due to ignorance and of lack of knowledge of what this dangers or what this product poses to their health. But one would tend to ask, what about the parents of these children and the guardians? Are they asleep?
Well, let me start from where Enoh stopped.
Okay.
That this action by the tobacco industry is deliberate. There is a study that has just been done by advocates across the region. Cameroon, Togo, and I think Senegal. We are currently doing same thing in Nigeria. We've done Lagos. We're going to do Zamfara, Enugu, Oyo, and some other states. And what we found out were that these companies are deliberately putting products very near schools. They get some of these retailers to put cigarettes in some kind of cellophane that they can hide it, which means it's deliberate. That if people are coming around, they can withdraw it. In some cases, they display tobacco products around, cookies, around biscuits, around chocolate and things like that kids like. So they see the image. And when they see those images, there are tendencies that they may want to try what those products are. So there are deliberate marketing of tobacco products where children frequent. And we're asking government to stop that. Back to the home front, we've also seen that a report just released by NOI polls shows that close to 370 children die every year as a result of exposure to tobacco smoke. Some of them might not be direct smokers. They could be passive smokers. And we've got to lose them within their prime, even before their adulthood. These are kids that are being exposed to smoking either as a result of their dad smokes or their mom smokes, or they smoke around schools or around places that they go to play. And that's where the issue of legislation comes into place. That, the Nigerian or African law, whichever country on the continent, should ensure that the rights of the children are protected by ensuring that they're not in any way exposed to tobacco smoke, either in the home, in the school, in wherever they play or wherever they frequent. So we want to see legislation across the continent that will prohibit selling and smoking of cigarettes, near schools. We want to see legislation across the continent that will prohibit this, smoking by parents that are still having kids less than 18 years in their homes, and such, creative means of protecting, our kids are some of the things that, governments can do to help us, and our parents, they themselves must also lead by example.
All right, let me quickly get to Seso, who joins me via phone. Obviously, well, we hope to have a clearer audio now of you. Seso, how far do you think heavy taxes can go to, well, weaken the activities of tobacco companies?
Yeah, the tobacco companies, you know, they have the marketing strategies, and those tobacco companies such as BAT, Philip Morris International, they have the strategies targeting, and as what he was saying, the strategies, the end purpose is to increase the market. And today, as Africa is becoming a new market for them, then increasing the market is targeting the young Africans that we have that among the kids, and then preparing to have a new generation of smokers. And then several tactics that we have observed, in the country, across the country. And those tactics, we observed them during a survey that we did in several countries in Africa. And we saw that really egregious, we are having some egregious tactics around the schools today going on.
All right, Leon says so. Let's leave it here at the moment. We would like to thank you very much indeed for your contributions on the program. How culpable is the government to this matter?
Well, to look at the culpability of government, I'll go back to your question on taxes.
Yeah.
All right? So why is cigarette? Why are they cheaper than candies? Why are they cheaper than sweets? Why are they cheaper than what we daily need? Why is a stick of cigarette cheaper than a sachet of milk? These are critical questions that the government should answer. Why is it that a pack of cigarette is selling for £5, £7 in UK and is selling for 200 naira in Nigeria when the exchange rate is about 500 naira? Who is subsidizing what? So the government needs to put in place appropriate taxes on tobacco products. One, to raise money. Two, is also to ensure that cigarettes are not accessible to kids. So, and when we look at the global order in terms of public health, there is the Framework Convention on Tobacco Control, which a lot of African countries signed onto, but that has not been fully domesticated by the governments of those countries. Nigeria government, probably Ghana, some other governments, all inclusive. Here in Nigeria, we have a law that needs regulation for it to be effective. We're still battling with the Nigerian government to put in place those regulations so that that law can be active. So they need to be proactive. Every day people are dying. 12,000 or 17,500 Nigerians dying everywhere as a result of smoking. We need to save those lives. This is one of the most preventable causes of deaths, causes of cancer in the world. Action, policy, that's what our government needs to do. And if they don't do that, so they are culpable. They are, in a way, promoting this culture of death and destruction, social injustice, social dislocation being inflicted on our region, on our continent by the tobacco industry. And then
we're talking about the culpability of the government in this matter, because some would link it to the bribery and corruption that is known in some African countries. Do you subject to that?
Last year there was an expose about how the tobacco industry has been bribing governments not to put in place legislation, not to put in place appropriate laws. It took us close to 11 years to have laws passed in Nigeria. That's strange. A public health law, every survey shows that over 85% of citizens want tobacco control. They want regulation against smoking. Yet the government will not buy into that and put in place effective measures. What is going on? One parliamentarian at a point called it unparliamentary lobby. I don't know what that means, but it also means under the table lobbying by those industries. You understand? Yeah. These are the issues that are affecting our public health that the governments across the region needs to stand up and be counted and stand up for public health.
Quite an analysis there. But let me quickly get to you, Eno. If you can hear me now, I hope it is a bit clearer. How can the civil society, the government, and tobacco companies work together to create a smoke-free generation?
With the FCTC treaty that Bode spoke about, we hope that the tobacco companies are not part of this discussion, because we all recognize that they're only there to make profit, and they will try to delegitimize the whole process. We know that civil society and the government in some African countries are currently working together. As we mentioned earlier, even just building your knowledge and building your awareness on some of these issues is always very helpful. And that's what civil society has been doing with government in the past couple of years. And as the knowledge grows and understanding grows on what the tobacco companies are trying to do, government is beginning to see that the tobacco companies are not good partners with the work that we are trying to do. So yes, civil society and government are working closely together across countries in Africa, and as we keep on working with government, they keep learning more and we keep expanding on that. And we recognize that once we are able to build that knowledge across parliamentarians and government officials, more will be done to protect citizens of the countries.
All right, for this last part, okay, let me quickly thank you now, Eno Esong, for your thoughts on the program. It's a pleasure to have your contributions on Africa Today. Thanks a lot.
Thank you.
All right, let me bring it back home to you now, Bode. Yes, we've had this issue more like an opting time now, tobacco. But the implementation here is the key, because Lagos State has already, enacted a law making it it's unlawful now to smoke in public. But still, we have smokers who go about doing this without any fear for anything entirely. They do this like, it's a common thing. But what must be done to ensure that tobacco smokers, are put to a stop? And not just tobacco smokers, the tobacco makers themselves are put out of the market.
Let me refer you back to the Lagos State law, because there was an interesting dimension. Immediately Lagos State enacted that law. Then a very prominent tobacco company in Nigeria called the law enforcement officers for training. And have you seen where Mosquito is teaching us how to cure malaria? That was exactly what happened. So the law never got implemented. A core issue is what Eno have said. The global standard is that we should keep the mosquito out of that discussion. That's the vector, the tobacco industry. Then the governments across the region must be able to insulate public health from the tobacco industry. That is when we'll begin to see serious enforcement. At the national level, government also must be able to insulate their policies and their programs from the tobacco industry and take public health as priority. Prioritize public health above whatever gains that the tobacco industry flaunts, which actually not true. I mean, that's the way to go.
And I really hope that we'll get an end to this situation and we don't come back talking about this once more.
I hope so.
Well, thanks a lot, Bode. It's a pleasure to have your thoughts and contributions on the program. Bode Olufemi, thanks a lot.
Thank you so much.
Well, with an ever-growing young population, Africa is largely breaking out with greatness, except that there are plantations of tobacco with smoking sticks of cigarettes virtually standing in the way. Preventing the health and socio-economic consequences would entail relentless awareness campaigns and aggressive interventions in tobacco control across Africa. And that's our package for today. But don't forget to join the conversation on Twitter at TVC Connect. And also follow me for updates around Africa at Esther TVC News. Until the next one again, I am Esther Mokwariola, and always remember, this is Africa. Bye for now.